The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So we are quite aware of the numerous concerns that have arisen from our rollout of the international travel and testing protocol. Testing and self-isolation remain very crucial scientific approaches that the PTF is using to mitigate the spread of coronavirus in Nigeria. We continue to work tirelessly with foreign governments to ensure that the entire entry process into the country is seamless, it's safe, and it's also sustainable. So with that in mind, we know that various countries have different approaches to testing, and a good number of them charge for PCR tests. The PCR tests that we do in country for public health purposes remain free and can be accessed by any person within a government medical center. Travel-related costs will be charged because they are personal costs that at the moment will be a risk to our public health response if they were to be made free. The private sector has been supporting our efforts with the testing of international travelers in order to meet the growing demand and to make the testing more efficient. Other countries, both in Africa, in Asia, and even in Europe, are implementing similar protocols. Currently, about 5,000 air travelers come in and out of Nigeria. And the PTF wants to ensure that we do not lose the gains made in the response. It is therefore critical that passengers get tested and follow protocols correctly. When fully open, the number of passengers going through the country is not small. At the moment, our daily testing numbers is about 2,500 a day. If we add the passenger numbers coming, potentially we are tripling the number of tests we do every day. And that's why we have to use the private sector to get this leverage, while at the same time working to bring down the cost for passengers. Therefore, it will be costly and unrealistic for the federal government to bear the cost of a test for each passenger coming into Nigeria. This will not only be unsustainable, but will also redirect precious resources away from the public health response. I'm pleased to say that the private laboratories that are now on the platform have resolved issues around registration and generating of the QR code. However, the PTF will continue to monitor and mitigate issues as they arise. So why is it important to test before and after arrival to Nigeria? Testing pre-boarding provides assurance to passengers that are within the same cabin that the persons you are sitting with are non-infectious at the time. And that's why we want the test to be done as close as possible to the time of departure. As close as possible to the time of departure. However, we have provided a validity for the PCR test to be presented to have a validity of 96 hours, in other words, up to 4 days, in order to cater for those that might have difficulty getting a PCR test done quickly in other parts of the world. We have realized that this is causing tremendous difficulty for some passengers in some countries that have long turnaround times. And for this reason, the PTF has agreed, and in line with the draft West Africa Health Organization guidelines, to extend the period of validity for the COVID PCR test that passengers need to board when coming into Nigeria from 96 hours to 120 hours. Nevertheless, we still continue to strongly recommend that tests be done as close as possible to the time of departure, because this is what will reflect the person's true infectious status, not only in the plane, but also at the point of arrival in Nigeria. We will continue to do testing at day 7 after arrival. When you arrive in the country, you will present your QR code, which is the barcode, which can only be generated if you have gone online to the portal and you have filled your health questionnaire and you have also uploaded your COVID-19 negative PCR result. The QR code can be generated even if you are having difficulty paying. We expect even diplomats to go online, use the portal to register and fill the health questionnaires and also upload their COVID-19 PCR results. Because if they subsequently turn out to be positive on testing, we need to be able to get back to our electronic systems and have a look at the results to make sure that the passenger did have a genuine result. It's also faster for the passenger if they have their health questionnaires filled before boarding, and it's electronic, because the system for clearing at the airport is very quick. While we continue to have issues with payment, we will not insist on evidence of payment before boarding, but we will be releasing a strong recommendation to airlines that preferably people come on board with a QR code. It will be a strong recommendation, but will not preclude boarding. We are urging passengers coming into the country to make sure they pay for their COVID-19 PCR test by day 7 of arrival. If passengers do not have a test for COVID-19 by day 14, our system will pick up those passengers, and if it is very clear they haven't had a test for COVID-19, their passports will be suspended for a period of 6 months. Therefore, it's really essential for non-Nigerians. Their visas on their way out of the country will be cancelled, so they might have difficulty coming into the country. It's very important we keep to this protocol, because it's a protocol that's been designed to ensure safe opening of our airports, and it's the only way that we can quickly open up our airports without further delay, allowing passengers to come in. In terms of numbers, from May till August 2020, we've undertaken evacuation and emergency flights into the country. There have been, in one instance, in several, well, not even one instance, there have been instances where passengers have left with COVID-19 PCR results that were negative, and on arrival, at the time when we used to test within a day or two of arrival, having positive results. In fact, of the passengers that came into the country, and we had more than 14,000 evacuated, on average about 5% of them tested positive for COVID-19, even though they had a negative PCR on boarding. We have identified 13 countries that had significant discrepant COVID-19 test results, of which 9 had a significant percentage that were discrepant, that we couldn't explain by just the incubation period. We are working closely with these countries to rectify the matter. We have met with the ambassadors, and we have also obtained additional information on the sort of testing that they do, and also assurance from these countries, together with a list of accredited laboratories that we can use. One of the reasons where you can have a discrepant result is if somebody uses an antigen-based test, which is less sensitive than a PCR and boards the flight. If they do have COVID, antigen-based test kits can miss as much as 4 out of every 10 confirmed PCR positives. So to enable early detection and to reduce the risk of further transmission based on the data and our current laboratory capacity, all incoming travelers must be tested by a certified private laboratory after 7 days of returning to the country. And there are only 3 criteria for these private laboratories to get onto the portal. Only 3. 1, they have to be licensed through the Medical Laboratory Science Council of Nigeria. 2, they must have undergone a process of validation and optimization by NCDC. And then thirdly, they must be accredited by the state governments because their results will feed into the state numbers. We have already reached out to at least 9 states, urging them to work with the private laboratories within their areas and come up with a list of accredited laboratories that satisfy this requirement. And these laboratories will go onto the portal. At the moment, we only have portals for Lagos and Abuja, but we have arrangements with the laboratories serving these areas to be responsible for collecting samples for passengers outside Lagos and Abuja. We're working very hard to open up more private laboratories across the rest of the country, and we believe that as more laboratories get registered and come onto the portal, the easier it will be to continue to push down the cost of a PCR test. In terms of self-isolation, all inbound travelers have a responsibility to self-isolate for at least 8 days. You test at day 7. You exit isolation at day 8 if you are negative for COVID-19. And we will also urge members of the community to help to enforce and police this, because this is all about being the good Samaritan. Other countries in other parts of the world, that's how they enforce their self-isolation. In fact, self-isolation is by far the most important tool in preventing transmission of COVID-19. In terms of exclusions to the portal, I'm pleased to inform you that in line with international protocols, we have excluded children below the age of 10 years. They do not need to have a COVID-19 test in Nigeria. They do not need to be paid, they don't need to be charged, but we would still request that their health questionnaires and their negative COVID-19 PCR results when they are boarding, where available, should be included. The same applies to the diplomats. We would expect them to fill the health questionnaire and also to upload their COVID-19 PCR results. Finally, it is important that we continue to remain vigilant. It is important that we continue to understand that while we open up international travel, we are yet to flatten the curve. And we really need to continue to keep our eyes on the ball. By opening up our airports, there's no doubt that there's that risk of possible importation, and we have to do whatever we can to mitigate this risk. We cannot risk a new wave of infections that will be a detriment to the lives of our country, men and women, and as well as our economy. Finally, the PTF is working with NCDC, the Federal Ministry of Health, and the Federal Ministry of Foreign Affairs to provide guidance to travelers, advisories in terms of travel to high incidence countries. And this will be updated regularly, similar to what happens in other parts of the world, so that Nigerians will be informed of the risks so that they can avoid non-essential travel. Thank you.